What is buprenorphine? Buprenorphine is an opioid medication used to treat opioid use disorder OUD, acute pain, and chronic pain. Buprenorphine is used for opioid addiction to reduce cravings and withdrawal symptoms without causing euphoria or dangerous side effects, and helps prevent relapse. It works by being a substitute for the drug being abused, so the patient has minimal discomfort, which allows the patient to focus on their recovery. Buprenorphine for OUD is used as part of a complete treatment program that also includes counseling and behavioral therapy. For opioid use disorder, buprenorphine is available as long-acting injections Sublocade, Brixadi, and sublingual tablets Subutex discontinued, generics available. Buprenorphine is used to treat acute pain that is severe enough to require an opioid analgesic and moderate to severe chronic pain that is not controlled by other medicines. For chronic around-the-clock pain, it is available as buprenorphine skin patches Butrans and buprenorphine buccal films Belbuca. And for acute pain is available as an injection Buprenex. Buprenorphine naloxone combinations are also available to be used for opioid addiction and include sublingual film Buneval, sublingual film, and sublingual tablets Suboxone, and sublingual tablets Zubsolv. Buprenorphine's mechanism of action is that it is a partial agonist at the mu opioid receptor and an antagonist at the kappa opioid receptor. Is buprenorphine a controlled substance? Yes, buprenorphine is a Schedule III controlled drug, which means it has a potential for abuse more than those in Schedules 4 and 5. If abused, it may lead to moderate or low physical dependence or high psychological dependence. Warnings: misuse of opioid medicine can cause addiction, overdose, or death. Keep buprenorphine in a place where others cannot get to it. Patient access to naloxone for the emergency treatment of opioid overdose. Patients should have access to naloxone to treat opioid overdose based on the patient's risk factors for overdose, such as currently using a CNS depressant, a history of an opioid use disorder, or previous opioid overdose. Having naloxone available is important if the patient has household members including children or other close contacts at risk for accidental exposure or overdose. Taking this medicine during pregnancy may cause life-threatening withdrawal symptoms in the newborn. Fatal side effects can occur if you use this medication with alcohol or with other drugs that cause drowsiness or slow your breathing. Before taking this medicine, you should not use this medicine if you are allergic to buprenorphine, or if you have used another narcotic drug within the past 4 hours. To make sure this medication is safe for you, tell your doctor if you have ever had methadone treatment, breathing problems, sleep apnea, abnormal curvature of the spine that affects breathing, liver disease especially, hepatitis B or C, kidney disease, enlarged prostate, urination problems at head injury, or brain tumor, alcoholism, hallucinations, mental illness, or problems with your stomach, gallbladder, adrenal gland, or thyroid. Pregnancy: if you use buprenorphine while you are pregnant, your baby could become dependent on the drug. This can cause life-threatening withdrawal symptoms in the baby after it is born. Babies born dependent on habit-forming medicine may need medical treatment for several weeks. Infertility: chronic use of opioids may cause reduced fertility in females and males of reproductive potential. It is not known whether these effects on fertility are reversible. Breastfeeding: buprenorphine can pass into breast milk and may cause drowsiness and breathing problems in a nursing baby. Ask your doctor about any risk to your baby. How should I take buprenorphine? Use buprenorphine exactly as it was prescribed for you. Follow the directions on your prescription label and read all medication guides. Your doctor may occasionally change your dose. Never use this medication in larger amounts or for longer than prescribed. Opioid use disorder: buprenorphine sublingual. For OUD, buprenorphine sublingual is usually taken only at the start of treatment for addiction induction phase. Most people are later switched to long-acting buprenorphine Sublocade injection, or Brixadi injection, or another medicine that contains buprenorphine with naloxone bunavail, Suboxone, Zubsolv. You may receive your first doses of buprenorphine sublingual in a hospital or clinic setting until your condition improves. Use dry hands when handling the tablet. Place the tablet under your tongue and allow it to dissolve with your mouth closed. Do not chew the tablet or swallow it whole. If your doctor has prescribed more than 2 tablets per dose, place the correct number of tablets under your tongue at the same time and allow them to dissolve completely. Do not eat or drink anything until the tablet has completely dissolved in your mouth. Never crush or break a pill to inhale the powder, or mix it into a liquid to inject the drug into your vein. Doing so could result in death. Extended release buprenorphine subcutaneous injection for OUD. Buprenorphine extended release injection is given subcutaneously just under the skin. Sublocade is given in the abdomen monthly, and Brixadi can be given in your buttock, thigh, upper arm, or stomach, and can be given weekly or monthly. Sublocade should only be used when patients have received treatment with an oral transmucosal used under the tongue or inside the cheek buprenorphine containing medicine for 7 days, and are taking a dose that controls withdrawal symptoms for at least 7 days. Sublocade is injected as a liquid. After the injection, Sublocade changes to a solid form called a depot. The depot may be seen or felt as a small bump under your skin at the injection site on your abdomen for several weeks. The depot will get smaller over time. Do not try to remove the depot, and do not rub or massage the injection site. Sublocade is part of a complete treatment plan that should include counseling. Brixadi should only be used if you are currently receiving buprenorphine treatment, or if your healthcare provider has given you a test dose of buprenorphine first to see if you are able to tolerate it. If you are new to Brixadi treatment, the upper arm should only be used after 4 doses of Brixadi in your buttock, thigh, or stomach. Brixadi is injected as a liquid after the injection. The liquid changes to a gel form called a depot. The depot is not always felt under the skin. Do not try to remove the depot. Brixadi is part of a complete treatment plan that should include counseling. Pain. Buprenex buprenorphine injection is used for pain. It is given by deep intramuscular or slow over at least 2 minutes intravenous injection at up to 6-hour intervals as needed. Butrans skin patch is used for chronic around-the-clock pain. It is applied once a week and worn continuously for 1 week. Do not change your dose. Apply Butrans exactly as prescribed by your healthcare provider. Your doctor will prescribe you the lowest effective dose for the shortest time needed. Do not take hot baths or sunbathe. Use hot tubs, saunas, heating pads, electric blankets, heated waterbeds, or tanning lamps, as these can cause an overdose that can lead to death. Belbuca buccal films are used for around-the-clock treatment of moderate to severe chronic pain. Using a finger, place the yellow side of the Belbuca buccal film against the inside of your moistened cheek. Press and hold the Belbuca buccal film in place for 5 seconds, and then take your finger away. Once in place, the film will dissolve completely in about 30 minutes. Do not eat or drink anything until the Belbuca film has completely dissolved in your mouth. Rinse your mouth with water after the medicine dissolves. Wait 1 hour after the film dissolves to brush your teeth to prevent damage to the teeth and gums. Do not chew the Belbuca film or swallow it whole. You should receive regular dental checkups while using Belbuca. Opioid use disorder. Buprenorphine sublingual for OUD. Buprenorphine sublingual is usually taken only at the start of treatment for addiction induction phase. Most people are later switched to long-acting buprenorphine Sublocade injection, or Brixadi injection, or another medicine that contains buprenorphine with naloxone bunavail, Suboxone, Zubsolv. You may receive your first doses of buprenorphine sublingual in a hospital or clinic setting until your condition improves. Use dry hands when handling the tablet. Place the tablet under your tongue and allow it to dissolve with your mouth closed. Do not chew the tablet or swallow it whole. If your doctor has prescribed more than 2 tablets per dose, place the correct number of tablets under your tongue at the same time and allow them to dissolve completely. Do not eat or drink anything until the tablet has completely dissolved in your mouth. Never crush or break a pill to inhale the powder, or mix it into a liquid to inject the drug into your vein. Doing so could result in death. Extended release buprenorphine subcutaneous injection for OUD buprenorphine extended release. Injection is given subcutaneously just under the skin. Sublocade is given in the abdomen monthly. And Brixadi can be given in your buttock, thigh, upper arm, or stomach, and can be given weekly or monthly. Sublocade should only be used when patients have received treatment with an oral transmucosal used under the tongue or inside the cheek buprenorphine containing medicine for 7 days, and are taking a dose that controls withdrawal symptoms for at least 7 days. Sublocade is injected as a liquid. After the injection, Sublocade changes to a solid form called a depot. The depot may be seen or felt as a small bump under your skin at the injection site on your abdomen for several weeks. The depot will get smaller over time. Do not try to remove the depot, and do not rub or massage the injection site. Sublocade is part of a complete treatment plan that should include counseling. Brixadi should only be used if you are currently receiving buprenorphine treatment, or if your healthcare provider has given you a test dose of buprenorphine first to see if you are able to tolerate it. If you are new to Brixadi treatment, the upper arm should only be used after 4 doses of Brixadi in your buttock, thigh, or stomach. Brixadi is injected as a liquid after the injection. The liquid changes to a gel form called a depot. The depot is not always felt under the skin. Do not try to remove the depot. Brixadi is part of a complete treatment plan that should include counseling. Pain Buprenex buprenorphine injection is used for pain. It is given by deep intramuscular or slow over at least 2 minutes intravenous injection at up to 6-hour intervals as needed. Butrans skin patch is used for chronic around-the-clock pain. It is applied once a week and worn continuously for 1 week. Do not change your dose. Apply Butrans exactly as prescribed by your healthcare provider. Your doctor will prescribe you the lowest effective dose for the shortest time needed. Do not take hot baths or sunbathe. Use hot tubs, saunas, heating pads, electric blankets, heated waterbeds, or tanning lamps, as these can cause an overdose that can lead to death. Belbuca buccal films are used for around-the-clock treatment of moderate to severe chronic pain. Using a finger, place the yellow side of the Belbuca buccal film against the inside of your moistened cheek. Press and hold the Belbuca buccal film in place for 5 seconds, and then take your finger away. Once in place, the film will dissolve completely in about 30 minutes. Do not eat or drink anything until the Belbuca film has completely dissolved in your mouth. Rinse your mouth with water after the medicine dissolves. Wait 1 hour after the film dissolves to brush your teeth to prevent damage to the teeth and gums. Do not chew the Belbuca film or swallow it whole. You should receive regular dental checkups while using Belbuca.